Boa tarde. Good afternoon, everyone. So it's a pleasure to welcome you to this critical discussion on habitats and heat relief. This is the final panel of the day. We explore infectious diseases, dengue, water conservation, food systems, agriculture, and so many more topics. All important, all critical, as well as this one that we will speak today with this fabulous group of panelists. So as Professor Montgomery pointed out this morning, global warming is accelerating. There is no doubt among scientists that we live in a warming world and that heat waves are becoming more frequent, more intense, and more dangerous. I'm sure that most of us have already experienced very hot days and even heat waves. And without going any further, Rio de Janeiro, just this past February, experienced the worst heat wave in a decade. The heat index reached 62 degrees Celsius, that is 144 Fahrenheit. And of course, causing illness and death. Globally, the World Health Organization estimates that every year around 500,000 people die due to heat-related causes, and that number is growing. In this context, cities are becoming heat islands, experiencing the worst impacts of this crisis, since concrete and asphalt capture and retain heat. As this situation evolves, the impacts of heat waves on people's health, ranging from heat strokes to respiratory diseases, cardiovascular diseases, are also becoming more severe, especially for vulnerable communities, since heat waves don't impact everyone equally. In this context, there is an urgent need for sustainable solutions to protect urban populations. As we will discuss today with our group of panelists, many solutions city planners are already implementing are rooted in nature, contemplating green spaces and green infrastructure. By integrating nature-based solutions into urban planning, we can improve air quality, enhance cities' resilience to extreme heat, and create healthier and more livable cities while also tackling climate change. Today, as I said, we have a remarkable group of panelists who will walk us through all these interrelated topics related to climate change, heat, and a warming world. So with me, I'm joined in the stage by Lisa Beyer. Welcome, Lisa. She's the Senior Manager for Nature for Urban Resilience at the World Resources Institute. Lisa leads the strategy for urban nature-based solutions, and she works at the intersection of ecology, design, and community resilience. Virtually, we have three panelists, experts. We have Karl Astbury. He's the program lead on climate and health at Resilient Cities Network. Karl provides support to cities in developing and scaling climate and health programs with a special emphasis on extreme heat and vulnerable populations. Welcome, Karl. We are also joined by Madison Cole. She's a senior economist at Mode Economics. Madison specializes in climate impact modeling and the economic dimensions of adaptation. Welcome. And then we have also Giselle Sebag. She's executive director of the International Society for Urban Health. Giselle works to advance urban health equity via research, advocacy, and systems levels change. So let's dive into the discussion. As I was saying, heat-related illnesses are becoming more prevalent, especially in urban settings. So I would like to begin asking Karl, based on your experience, what are the most critical health issues resulting from extreme heat? And how are cities currently addressing these negative impacts on people's health? Karl?
Thank you, Adriana, and greetings from the UK. It's the last session of the day, I think, guys. So
Yes.
I hope everyone is bearing up well and the conversations and insights are sparking all sorts of amazing ideas and collaborations are blossoming in the room. You're nearly at the end as well, so I'm sure you can enjoy some much deserved refreshments and food later on today. I want to start on a point that everyone here at the summit already very clearly knows and was iterated by Adriana in her introduction. It's getting hotter, and it's not by a little bit either. By 2100, the world is projected to warm by nearly 3 degrees. Even if we limit that to 2 degrees, heat-related deaths are expected to rise by 370% by mid-century, which is extraordinary. And heat's often called the silent killer. Victims of heat stroke or exacerbated heart and kidney conditions rarely make those headlines, but nearly 500,000 people already die each year from heat exposure. And as Adriana mentioned, that toll is growing. In recent years, people have endured an average of 86 days of dangerous high temperatures annually, almost a quarter of the year under some kind of heat stress conditions. And those are all kind of very abstract figures, but they're real people, aren't they? They're patients in emergency rooms. They're older adults isolated in hot homes. They're workers who are collapsing on the job. And cities are really at the centre of this crisis. Urban areas trap heat. There's less vegetation, there's more concrete, and cities can be several degrees hotter than nearby rural areas, especially at night. And urbanisation is accelerating. Half the world's population lives in cities today, and that's expected to rise to 70% by 2050. So that means many, many more people are going to be exposed to urban heat islands, particularly in poorer neighbourhoods with the fewest resources. And I'm just going to take an example from one of the cities in our network, Quezon City, which is the most populous city in the Philippines. And many families there can't afford air conditioning, and informal settlements lack shade. And in April 2024, during a severe heat wave, schools in Quezon City and across Metro Manila suspended in-person classes to protect the children. And children were seen shading themselves with cardboard on the way home. That was their way of adapting to the heat. And that, stories like that really remind us that this isn't a distant threat. It's here, it's now, and really importantly, it's hitting the most vulnerable the hardest. And the health risks linked to heat are diverse and really deeply concerning. We think about heat exhaustion or stroke, but the impacts really run far deeper. Heat worsens cardiovascular and respiratory conditions, increases hospitalizations for heart attacks and asthma, can trigger kidney failure. Those with diabetes or mental health conditions are also at greater risk. And those hot nights, when you get those hot nights as well as those hot days, that means you get little relief. Sleep is disturbed, there's stress, anxiety increases. In refugee camps or slums, overcrowding in the shade heightens the spread of disease. And as these global temperatures rise, diseases like dengue fever are spreading further, affecting cities like Rio and Semarang, and many others, where mosquito-borne outbreaks are growing more frequent. And we explored some of this through a collaboration between ourselves and Yale University and some research we conducted last year, which surveyed nearly 200 leaders in 118 cities. And 2 in 3 identified extreme heat as a high concern, and that was alongside flooding and air pollution as the 3 primary concerns. Yet fewer than half have a climate resilience plan, and then only 1 in 4 cities address climate and health together. So there's a stark preparedness gap there. And city officials also pointed to who they worry about the most, and this won't come as a surprise. It's older adults, it's children, it's residents in informal settlements, it's outdoor workers. And these are the people who are least equipped to cope and adapt. And so what are cities doing? And many have stepped up. Many are taking really concrete action. Athens and Miami have appointed chief heat officers, as many other cities have done as well. And they're city officials which are really focused solely on heat risk. In Ahmedabad in India, a 2010 heat wave prompted the first heat action plan in South Asia, which introduced heat alerts, cool roofs and hydration campaigns. And that plan and the actions that plan has instigated, it's estimated that plan has prevented over 1,100 deaths per year within the city, which is incredible. Many of these actions are really low cost and have high impact. So whether that's opening public resources as cooling shelters, investing in tree planting, or improving heat alerts, these tools are at our disposal. But there's a really important point, which I'm going to come back to again, that we must use them fairly, because it's not just an environmental issue, this is it. It's a matter of justice as well. So within cities, the hottest areas are often the poorest, with the least shade, the poorest housing, and the fewest health services. And so cooling infrastructure and the mitigation and adaptive measures that we put in place must reach everyone, not just those who can pay for it. And there's real growing momentum around this, and around this whole agenda. And one of our partners put it, which I thought was a nice phrase, that we must put health at the heart of the urban climate change agenda. And we've got to begin to treat heat waves with the same urgency we reserve for infectious disease outbreaks or for flooding, because for millions, the climate emergency is already very distinctly and already very much a health emergency. So the burden of heat-related illnesses is increasing, but we're not powerless. And I've given some examples, but there's a huge, there's many more examples of cities who are leading the way. And I think it's through data collaboration and early action we can really begin to save lives and build more resilient, equitable cities.
Yeah, thank you, Karl. Yeah, as you well said, extreme heat is not just a climate problem. It's threatening our cities, the lives of people, and cities need to act now, urgently. The following question is for Madison. So Madison, what is the economic cost of inaction when it comes to extreme heat? And how can we quantify the financial burden of heat-related illnesses on our health systems and economies?
Thank you, Adriana.
It's a long question.
No worries. Thank you for your question. It's okay that it's long, and I'll try to keep to 5 minutes or so. But to answer your question quite briefly, the economic costs are immense. So both yourself and Karl mentioned the mortality impacts of extreme heat. 500,000 people per year die of heat-related causes. In addition to that, heat also drives economic losses. It does that in a number of ways. It makes people sick. When you're sick, you might miss work. And it also makes people less productive. You have to stop work to take a drink. You might work more slowly. You might have to miss work, etc. And our analysis at Mode Economics found that those effects are already responsible for $100 billion in lost productivity just in the US. And we found that this could increase by 5-fold by 2050. So while we can't directly extrapolate those figures to global losses, it can give you a sense of how we expect those losses to compound as climate change and the effects of climate change make this problem of extreme heat even more severe. And so while those figures are staggering, that 100 billion magnifying to 500 billion just in the US is actually an underestimate of extreme heat, the economic costs of extreme heat. And that's for two reasons. The first is that estimate doesn't include impacts on informal and unpaid labor. So formal economic data only captures a fraction of the impacts because not all costs are traded in markets. And much of the burden will fall on domestic and informal sector workers who tend to be poor and who tend to be female. And so, for example, we found that including unpaid work in our analysis increased the estimate of heat-related losses women experience by 260%. So that can give you some indication of how important it is to account for impacts, not just in the formal sector, but on unpaid and informal sector labor as well. The second missing component from those estimates are the compounding and long-term consequences of extreme heat. And I'll give a few illustrative examples to demonstrate what I mean. As I mentioned, when you miss work, you can lose your wages. That might force you to sell off your assets or to take a high interest loan to pay, for example, your medical treatment or to cover other short-term expenses. And that can lead to cycles of poverty, cycles of indebtedness, and basically just undermining your ability to improve your life. Extreme heat can also disrupt critical infrastructure in many, many ways. And one example is that extreme heat can disrupt pharmaceutical cold storage chains, which can lead to delays in people accessing their medication, which can lead to long-term health consequences, which can then magnify further. And you can see what I'm getting at, that these impacts can be devastating in scale, and they can compound and continue to compound, especially for the most vulnerable groups like low-wage workers and workers in the informal sector. At Mode Economics, we're building on existing frameworks to try and build a more complete picture of the costs of extreme heat on public health systems and economies. I can't go into tons of detail because our analysis is still under draft, but we're basically drawing on high-resolution spatial data on heat conditions, on population, critical infrastructure, and then we're combining that information with peer-reviewed research linking heat waves to heat stress and associated syndromes, all of those things that you were mentioning at the beginning, your worsened cardiovascular and respiratory syndromes, your pregnancy complications, et cetera. And so those geospatial data sets continue to improve and become more widely available. So we have a more full understanding of the costs of heat and the costs of inaction than we ever have. But there's still more to be done to build those long-term impacts and build out those estimates for the informal sector as well. I want to end by just saying that while these economic costs are arresting and they're eye-catching here in these forums, they really need to be in the hands of decision makers if they're going to catalyze action. So making this analysis available to policymakers and available to decision makers is really what will unlock action in adapting and undertaking those kinds of solutions that Karl was mentioning in his response as well. Thank you.
Thank you, Madison. As an economist myself, I could speak with you all afternoon. But as you well point out, the cost of inaction is far too high, and the time to act is, of course, now. So moving to solutions, what can we do to keep getting worse, to improve people's lives and their disease circumstances? I'm going to ask Lisa, what nature-based strategies can cities scale up to increase cities' resilience to extreme heat events, and which cities have done it successfully?
Yeah, thank you, and thanks for the opportunity, Forecasting Healthy Futures, to be here today on this panel. Well, we've just heard the growing challenge of extreme heat, and we know that this is most often impacting those with the least resources. Data shows strong correlations between urban areas experiencing extreme heat, housing low-income residents, and lacking tree canopy and access to open space or green space. And these areas are really often on the front line of climate impacts, extreme heat, but also inland and coastal flooding, poor air quality, as well as landslides. So our solutions have to be multifunctional and multi-purpose. And as you noted, nature is part of that solution. One of the ways that we address these climate impacts is with nature itself. In Ian McHarg's 1969 famous book, Design with Nature, that inspired me as a landscape architect. He advocated for consideration of natural processes in development, the idea to minimize impacts and then take advantage of natural infrastructure. And so when we talk about this, there are a lot of terms that people throw around: nature-based solutions, natural infrastructure, green infrastructure, blue-green infrastructure, eco-based adaptation, low-impact development, and even engineering with nature. But all of these are strategies that use the processes found in nature to contribute to human well-being and address the societal challenges. So in the global conversation, these are often referred to as nature-based solutions, and they take the form of forests and wetlands, riparian floodplains. Here we're protecting, restoring, and sustainably managing natural ecosystems. But we're also mimicking these systems with built approaches, which are often called green infrastructure. In urban areas, many of our natural landscapes have been degraded or lost through development. And so cities are introducing new tree plantings, open spaces in green parks, greenways, as well as sustainable urban agriculture that we heard a little bit about, reintroducing creeks that might have been degraded, daylighting, and capturing and reusing stormwater, as well as retrofitting our buildings, adding green roofs and green walls. Similar to what Madison was talking about, $1 of investment today can save us $6 in future avoided costs. That's huge, US dollar. That's by a National Institute of Building Sciences and FEMA study. But it's really important, right, that while nature is part of the solution, it's not a silver bullet, right? The advantage of natural infrastructure is the multiple benefits: the heat attenuation, the air quality improvements, absorption and filtering of particulate matter in urban areas, regulating the climate, providing habitat and wildlife connections, as well as job creation. Additional health benefits like reduced stress and recreation opportunities to increase physical activity. So a lot of the talk has been about heat in terms of number of heat days, the temperature, but we're starting to talk about heat in a different way, which is in sort of thermal comfort, with multiple variables: solar exposure, your actual access to sun; ambient temperature, that's the typical condition that we talk about; radiant heat, right, the heat that's coming off of surfaces, which is so critical in our paved and impervious cities; humidity, and the potential for airflow, which is definitely impacted, right, by our development. So natural systems are supporting this extreme mitigation by covering surfaces, right, to create shade, changing the surface condition to reflect rather than absorb that heat. And then a natural cooling because they're of evapotranspiration, right? They're actually releasing water into the air naturally. So tree canopies and vegetation have the potential to reduce temperatures through this shading and evapotranspiration by 1 to 5 degrees Celsius in summertime. It's a huge amount, right? And they're not just reducing temperatures, but they're sequestering carbon. So they're actually helping us limit future warming, right? So a recent study in the Los Angeles area looked at the carbon emission reduction from their tree canopy cover across the city. And in the daytime, it actually captures 60% of those carbon emissions. Extreme heat is exacerbating air pollution, but plants can help reduce it, and the number of premature air pollution deaths, which is estimated at 7 million per year. Green spaces also kind of decrease our stress, right? They're fostering community interaction and opportunity for physical activity. So, not only are these good for the environment and human health, but they have an economic benefit as well. And according to a recent World Economic Forum report, cities' infrastructure and built environment that are nature positive can create over $3 trillion in business opportunities and 117 million in jobs by 2030. So the key is creating this network of green and cool spaces that are accessible for all, right? Green infrastructure at its core is about green hubs and links. Hubs ensuring that we have open space and green spaces, and links that are making those connections for all of the community, as well as our plants and animals. So we can think about these at the site level, at the street level, at the neighborhood level, and across the city. And just a couple examples that I wanted to raise up is just here in Rio, actually. Luis Casiana, which is a resident of Parque Arara favela, initiated a green roof movement in his neighborhood. So this is a very exciting community-driven approach to managing heat. He was inspired to act after Rio had a 2012, so 12 years ago, 13 years ago, major heat day. That's been sort of broken again at 43 degrees Celsius. But he started to experiment on the favela roof, his own home, and he worked with scientists and academics to actually create a low cost and low weight green roof system. And now he's started his own nonprofit, Teto Verde Favela, and he's really trying to sort of create a movement of green roofs. His roof, a study in 2015 showed that his home was actually 4 degrees Celsius, up to 4 degrees Celsius cooler than his neighbors, just right next door with that green roof. So this is powerful work that our greenery can do. And maybe just one more to share is in Medellin, there's a series of green corridors, the Medellin Green Corridors Project. It was part of the city's approach to create healthier, more sustainable and equitable city by planting 36 green corridors, connecting kind of the periphery to the urban center and job center. The project focused on 18 corridors on major roadways and 18 corridors on waterways, covering 36 hectares with greening and trees and shade. So this really helped both reduce the heat, 2 degrees Celsius on average and up to 4 degrees Celsius in some areas, but the focus was on putting these greenways in areas that lacked green space and didn't have access to green space. So in addition to reducing heat, they actually also created opportunities for employment. So these green corridors, the gardeners are basically employing migrants that have entered the city and displaced from other parts of the country, both educating them and then employing them. So it's kind of a win-win situation. And maybe I'll pause there.
Thank you, Lisa, for pointing out to these very interesting nature-based solutions that offer scalable and cost-effective ways for mitigating heat events, and also providing these examples, green roofing and things that can be scalable, probably. So one problem that can appear is aggravating social and environmental inequalities while implementing nature-based solutions. So I wanted to ask Giselle, how can we make sure cooling and heat adaptation projects really help low-income or marginalized neighborhoods? And how can we involve community voices in city planning so that solutions don't contribute to further displacement?
Thank you so much. That's such a great question, Adriana. And I also want to thank the entire Forecasting Healthy Futures team, especially Kelly and Carrie, for convening such an important space for dialogue. I do really wish I could be there with you all in person. It's one of my very favorite cities in the world, so please enjoy. All the other comments so far I think have been so relevant. Karl, Madison, and Lisa already covered a lot of the really important points brilliantly. I kind of feel like we're on the same wavelength, Lisa. You'll see why in a little bit. But I'll try to sort of focus my comments on the issues of equity and inclusivity that were raised. So first of all, just to say, when we talk about extreme heat, I think it's easy to frame it largely as an environmental issue. But the reality is that heat is a public health crisis, and it's one that's deeply shaped by place. As was mentioned by Karl, heat doesn't affect all people equally, and that's because it doesn't affect all neighborhoods equally. And we know that in cities across the world, communities have long been excluded from public investment, whether it's through redlining in the US or other forms of geographic segregation and structural marginalization or spatial disconnection that we see in countries like Brazil and really all over the world. And we know that those places are consistently hotter, less green, and more vulnerable. But that we also see that history etched into the physical form today. So we see the highways that divide, these neighborhoods. We see zoning that clusters polluting industry near homes in specific neighborhoods. We see blocks of impermeable pavement that have little or no, tree cover or nature or shade. And these conditions, they didn't happen by accident, right? They were designed that way. And they are now really driving these place-based health disparities that we see. And Karl mentioned a lot of them, so I won't go through, all of them in detail. But of course, we know that we see so many of these heat-related illnesses like cardiovascular stress or asthma or kidney failure, or even, exacerbating these mental health impacts that we're seeing more and more of, like anxiety and isolation. So when we start to think about the strategies that are most effective, we really have to start by acknowledging that a one-size-fits-all approach isn't going to work. And that mitigation and adaptation, really, it needs to be community-specific and culturally grounded and led from within the community by residents themselves. And we've seen this working all over the world in small neighborhood, community-led efforts. The key, the way I think about it is that the key is that communities themselves are driving the process of neighborhood adaptation because they are the experts of their own realities and lived experiences. And only the residents themselves understand the complex, interconnected, and systemic ways that urban heat is impacting their daily lives. And that is shaped by the unique cultural, political, and social context of which every person lives. So I do have an example in Ahmedabad, a grassroots urban poor community action organization that I've worked with for more than 10 years now called Mahila Housing Trust. They partnered with local leaders, so they work largely with women, also a local entrepreneur and some architects to design, develop, and finance an innovative cool roofing system. So we already heard a little bit about cool roofs in another part of the world, so I'm gonna bring us to India as well. And these cool roofs were designed very differently, they were created very differently, and they ended up reducing heat inside the home by 3 to 5 degrees Celsius, which is significant. But the reason that a community-driven heat mitigation strategy was so important here was not only that this neighborhood disproportionately suffers from heat, of course it does. That heat in Ahmedabad can reach 47 degrees Celsius or 115 degrees Fahrenheit a day for several months over the summer with dire consequences. We have an example from 2010 where 1,344 people were killed directly from the temperatures that were, over 1 week period that reached 46 degrees Celsius. But 53% of those fatalities were women. And these women, like approximately 1.1 billion others around the world, were living in these informal self-built conditions. And they lacked legal land tenure. So in the design process of this innovative roof that was designed for them in their specific context, they went through hundreds of design iterations with the team, and they insisted on the ability to pack up their roof and move it in the case of eviction. And also the neighborhood lacked public spaces. So the women actually wanted, and again, they had to go back to the drawing board several times, but they wanted a flat roof so they could use it as additional space in their home for social gatherings. They do kite flying there, their kids to do their homework there, but also some people had started to adapt to the heat by sleeping on their roofs, and they wanted to maintain that and ensure that that was possible. So they felt really strongly that the design needed to reflect their specific uses. And because of cultural norms, women were largely unable to work outside of the home. So adapting the home to be a livable temperature was essential, not only to ensuring that their kids were able to do and complete homework indoors, but also that the women who spend the majority of their lives inside the home weren't spending their time in dangerously hot conditions. And it enabled families who designed and purchased a cooling roof. Actually, many families we saw in the data were able to open or expand an existing economic activity within their homes. So that actually was unlocking economic opportunity and the possibility of a better quality of life for many families who were suffering disproportionately from heat inequity. If you're interested in more, we actually went to Ahmedabad and documented a lot of these stories about how women's lives changed because of reducing the heat. That's available at acehealthequity.org. But we also have plenty of strong local policy tools to ensure that legacy residents are able to stay in place. But I'll just say from my experience working in cities around the world, unfortunately, few cities are really using them in a substantial way. I think that city and climate resilience activists, like all of us, really should be using health equity data to target our investments in the neighborhoods that would benefit the most. And then residents themselves should be driving the process of local transformation so that it can reflect their own assets, challenges, and context in the process. And not only does this ensure that residents are the ones who benefit the most and maximize the return on investment, but it also helps to develop a self-sustaining mechanisms for maintenance and for ongoing locally led financing. By integrating community voices, it's much more than sort of just consulting. It's really they should be driving the process. They should be sharing in the power and opportunity to shape their own neighborhoods and embedding equity into the design of both policy and driving also private sector change from zoning and housing codes to funding formulas and heat action plans, as were mentioned. And we actually do have a lot of tools to support this. We have certification systems that explicitly reward private sector developers, that prevent displacement and prioritize vulnerable populations. Because at its core, the way I think about it is that the goal should be, and I know Majora Carter says this so well, no one should have to leave their neighborhood to find a better one. And in this case, I think no one should have to leave their neighborhood to find a livable climate, right? Displacement is actually not adaptation. And if we're serious about climate justice, we have to ensure that our investments improve conditions in place, strengthening not only the physical infrastructure, but also the social fabric that sustains health and resilience in a comprehensive way. So the most effective strategies I've actually seen combine that climate adaptation with this aspect of community ownership. And then public health and urban planning and data really come together with this lived experience. Because ultimately, heat resilience and health equity are two sides of the same coin, right? But we only get there when the people who are most impacted are the ones who are actually shaping that path forward.
Thank you so much, Giselle. It totally makes sense what you say, that one size model doesn't fit everyone, that we need to include women, the more vulnerable neighborhoods, and avoid displacement. And that can be done also by empowering local voices, aligning solutions with lived experiences, and through more participatory processes. Now moving into policy recommendations for better planning. How can we do it? So, Karl, according to your experience, how are cities reimagining their infrastructure to mitigate extreme heat and stay cooler while making sure the benefits reach the most vulnerable populations?
No, thank you for the question. And just to echo Giselle, I think as a panel, we're all very much aligned, and it's amazing, really, to hear this. I think that's testament to, our role as activists and how we're taking this issue seriously and how we're actually understanding and trying to remedy the issues the huge issues that we face. And also, talking to Giselle's point, that place-based approach is really key. We talk about place-based approaches all the time, and also the data and being data informed. And I like to think, sometimes think about we've got the ideas, we've got the solutions, they're there in the ether. Lots of science has been done. What's the barriers? What barriers are cities facing? And I think it boils down to three things. I think it's partly about information and access to information and be able to understand that information. So whether that's data and how you combine that data and how you use that data. It's partly about resources, and that could be financial resources or capacities within local government or capacities within communities. So resources, and then political will. So, have you got the political will actually to drive the change? Have you got the political will to give power to communities, actually, which I think is hugely important when we think about some of these issues. We've talked about how heat waves are going more frequent and intense. I'm not going to hammer that point home anymore. And policymakers and urban planners are beginning to reimagine how cities can not only cope but also thrive in this hotter world that we're in, and which is only going to get hotter. And we've previously discussed all the health risks, and now we'll turn to some of the solutions. And I think the challenge here is twofold. We need to try and make our cities safe and livable despite the increasing heat. And secondly, really importantly, we need to ensure that the adaptations we put in place reach everyone, and especially the most vulnerable. And that means rethinking all sorts of things. It's everything from building codes and public spaces to how the emergency services work and migration planning. And heat is already influencing where people live and work. In rural areas, drought and rising temperatures are pushing families to move to cities in search of opportunities. And meanwhile, in cities, there's urban neighbourhoods, especially those lacking trees or shade. They're becoming so hot that residents who can afford to are relocating to cooler areas. So cities are having to now prepare for both the influxes of climate migrants and also supporting existing residents increasingly impacted by heat. And I think one of the key steps is embedding heat risk into urban policy. And that starts with how we design our environments, how we design our streets, our homes, our schools, our public spaces, and how they all need to be built for cooling. And some cities are now beginning to update their building codes, requiring reflective roofing, which we've talked about different types of roofing materials and how they need to be place-based, shaded walkways, ventilation standards. But lots of these are for new developments, and actually we need to retrofit the existing housing that's there, which is most probably a harder task today. And greening cities, and I know this conference has been talking a lot about this, greening cities is also hugely essential. Trees and parks and cool neighbourhoods, as we all know, but it also has that, build such improvements in health and quality of life. And an example I want to talk to, I'm going to go back to Quezon City in the Philippines, and we've been running a program called the Oasis Schoolyards, and that started out in Paris, when Paris experienced really significant heat waves. They were looking at ways to kind of address those heat impacts, and they've realised that schoolyards are kind of equidistantly placed across the city, and most of them are tarmacked over. And actually, is their way of greening these schoolyards and also improving access for the wider community into these newly greened urban oases. So they're in Quezon City, we're supporting them to transform those paved schoolyards into green shaded oases, and it's co-designed with students and co-designed with the teachers. And it offers almost a bit of a microclimate where children can learn and play. It helps absorb stormwater. It serves as a cooling refuge for the wider community during heat waves. Those spaces, what was once a concrete yard, is now something that benefits both the school and the school children and the surrounding communities. So I think we need to think about our spaces that we have and how we can transform those spaces and how we can open up access to those spaces for everyone, particularly those who are most vulnerable. But we must go further, and we must put equity at the front and centre. And building a park or transforming a schoolyard in a wealthy district isn't going to protect those in poor and more exposed neighbourhoods. So we've got to really think about how we do that. And cities are developing heat action plans that prioritise vulnerable groups and utilising data-informed approaches to make those vulnerability assessments. An example is in New York City, and there's a Cool Neighbourhoods initiative, and that uses data to map heat vulnerable blocks, and that helps direct tree planting, misting stations, and cooling resources. And there's one example which gets mentioned a lot, but it is great. In Freetown, Sierra Leone, the Tree Town initiative is planting 1 million trees to reduce heat in informal settlements. Cooling centres are another vital strategy, but that only works if people can access them, and also only works if you've got reliable infrastructure as well. And we need to ensure our infrastructure, our electricity grids aren't going to fail under high demand, that our water systems can keep on ensuring that people have access to water to ensure hydration, and that our health systems and health facilities are ready for emergencies. And increasingly, heat maps and public health data are being brought together, and I think that's a really important step that I think cities need to take. Bringing the Met Services data and your epidemiological data together and using that to guide where resources go. And cities need to collaborate with academic partners, and academic partners, for those of you in the room, need to collaborate with cities to make this happen. So I'm gonna pause there, because I realised I've just been talking quite a lot, and
No, that's fine.
I know everyone's near the end of the day. Thank you.
Thank you, Karl. Yeah, thank you for walking us through the steps to have more sustainable cities, and also the bringing, highlighting how data is important along with resources and the political will. So in that sense, I would like to ask Giselle, how should city planning and policies evolve to address more frequent heat waves, and how important is cross-sector collaboration?
Great, thank you so much. And I'm going to echo a lot of Karl here. We did not coordinate this, but I think we're very much on the same wavelength as we've said. So I really think that we need to move from reactive to regenerative planning. And so that does mean embedding cooling and regreening and resilience into everything. So sort of a health and all policies approach, but with that regeneration and with resilience at the core. And also making that explicit connection to health. I think for me at the International Society for Urban Health, that's often the missing piece and the missing link. And then also to echo Madison's work, and also to the economic impacts that has and the return on investment. And so that means making sure this is incorporated from building codes to capital improvement plans to green jobs training, everything across the board, across all the different disciplines. For example, we have standards in the United States, like the National Healthy Housing Standard, that encourages energy efficiency and ventilation upgrades, which those actually double, and those actually also help to do heat mitigation. We should continue to push for thinking beyond just the building envelope, right? And when we're thinking about housing, for example, we should ensure that neighborhood environments explicitly reduce heat and ensure comprehensively healthy neighborhood environments to support all of us. Each shared space, I think in New York City, we have a lot of stoops. So your stoop, your porch, whatever you have when you walk out your door, everything from that to your local school, or to the local park should be reducing heat, mitigating, and adapting to climate change. And to do that, as was mentioned, cross-sector collaboration is absolutely essential. So cities that have made the biggest strides, I think Lisa mentioned Medellin. Barcelona also has a Green Corridors program that's really amazing, and we've started to look at the mental health impacts of implementing that in addition to the physical heat reducing elements. Or Paris with its Cool Islands network, I think that was mentioned by Karl. They really did so by aligning the different health departments with the urban planners, with the housing agencies, and the residents, really bringing everybody together since day one. And they backed this alignment with data. We have really amazing data dashboards. We have the City Health Dashboard that my colleague actually helped to lead and put together. In the United States, we have the CDC Places, data set. It has been downloaded and preserved, although I believe it is currently not being updated at this particular moment. But it really does help us identify where heat intersects with vulnerabilities. Things like high rent burdens overlap with tree canopy loss, or with asthma rates, where there's are spiking alongside the lack of green space. So we really do have an opportunity to push for federal, state, philanthropic funding to prioritize these frontline neighborhoods, not just as sites of risk, but really engines of innovation and bringing cross-sector collaboration that is going to create the biggest possible impact. Because if we design with, not just for these communities, we really can create neighborhoods that are not only heat resilient, but also socially resilient. And that's something that we've been working a lot on, especially with the, this epidemic that we're now realizing has hit many, many countries and societies around the world of social isolation, loneliness, and social disconnection, this lack of social capital. We actually can start to solve many of these issues together. Because I think it comes down to this. It's the climate resilience, urban planning, and health. We have to move forward together because we have aligned goals. And I think that's the vision that we should really be fighting for. Heat resilience as a path to health equity. And not just surviving climate change, but really reshaping the entire systems that have made us vulnerable in the first place. That's what we focus on at the International Society for Urban Health, going upstream and looking at prevention so that we can prevent people from getting ill rather than trying to actually solve for challenges once they've already taken place, which, as Madison knows, is extremely expensive and not very productive, because then we put people back into the places that made them sick in the first place. So if we can get this piece right, we're not just adapting, we're transforming, and the return on investment is so clear.
Thank you so much, Giselle. I have a big sign here saying the time's up. I guess when you have fun, times fly. But we'll need to finish this discussion with a question for Madison, one for Lisa to round up this discussion. So, Madison, I would like to ask you, what are the economic arguments for investing in smart and equitable heat adaptation? And how can we incentivize governments and the private sector to take action?
Well, thank you. And yes, I hear you that the time is up. Yes. So I'll try and go quickly. So I'll again, similar to the others on the panel, I'll draw on a lot of what has already been said, because as mentioned, we're so aligned. But just to speak about the economic case for heat adaptation, it's very clear, and Adriana, you'll know that economists, we speak in the language of, it could be benefit cost ratios, it could be return on investment. It's basically, it comes in many forms, but it's, do the benefits outweigh the costs of this investment? And the answer for heat adaptation is resoundingly yes. And so I'll just give you an example. The World Bank carried out a study in various cities in India, I believe including Ahmedabad, which comes up in our conversation repeatedly. But they found that for every $1 you spend on heat adaptation, you get between $3 and $50 in benefits. Wow. And so this just shows how clear the economic case already is. But the point that I really want to make is that it could be strengthened, because I'm coming back to what I said in the first question you asked me, but this is just based on direct impacts, so that those $3 to $50 returns are based on simple impacts direct effects on labor productivity, and effects on health, direct impacts on health. So you can see that if we were to include a wider set of benefits, if we were to fully price and cost these heat adaptations, those numbers would be extraordinary. And so it's not just about making the economic argument, it's about making the complete economic argument, another case for more analysis. Then another part of incentivizing action, in addition to making the economic argument, is then finding and securing funding. And that's often where we run into additional hurdles. But cost-benefit studies are useful there as well, because not only do they produce these beautiful benefit-cost ratios that we can use to advocate for these wonderful adaptations that everyone is speaking about, but they can also identify the beneficiaries of adaptation measures. And if those beneficiaries enjoy monetizable gains from adaptation, then that can become the basis for innovative funding models. So, for example, we've spoken about green and light infrastructure, so planting trees and painting roofs to increase the reflectivity of them. Those interventions have been shown to improve worker productivity, reduce strain on energy infrastructure, and bolster property values. So municipalities could look at that and design public-private partnerships where the beneficiaries and the monetizable benefits that they get then help fund the intervention. So you could imagine that this could be, because businesses benefit from improved worker productivity, you could have business improvement districts funding that urban greening. Because energy utilities would benefit from reduced strain on infrastructure, you could have energy companies investing along with the public sector in reflective surfaces to kind of avoid costly grid updates. And then because property owners benefit from higher property values, you could issue municipal bonds that are tied to property values to repay the investment over time. So that's part of incentivizing action. And then the final part that I'll speak about today, there are surely more components of incentivizing public and private actors to take action on this, but the final one that I'll mention is just providing good examples. And there have been so many raised in this panel that I probably won't add more to the list, but it can be really useful to make the economic argument, to provide a funding model, and then to say, here's how this has worked in X city. Here is how this has worked in Y city. And show and make the case, as Karl did earlier, that this has been implemented in other cities and it's been successful in other cities. And so it reduces that kind of inertia barrier for policymakers and the uncertainty barrier as well to say, this is tried and true, it has worked, it is continuing to work, and so let's follow these examples.
Thank you, Madison. Yeah, I guess that collaboration is key to implementing these new approaches. So finally, Lisa, briefly.
Yes.
I would like to know, how can green cooling approaches provide long-term benefits for public health, equity, emissions reductions, and societies as a whole?
Thank you. Yes,
Thank you.
I will be very brief, and I'm happy to continue talking to folks who might be interested. But here I really wanted to emphasize that long-term benefits require a strategic approach to protecting, maintaining, and integrating natural infrastructure across our cities, especially in those areas that have been underinvested in and bear the brunt of most of the risk. So I wanted to lay out a roadmap, kind of my roadmap to new cities thinking about this, of how to kind of scale implementation. And I think first, cities really have to work on breaking down silos, right? Fostering collaboration. We've heard that a bit here in the development, management, and operation of urban ecosystems. Right now, we have different partners across cities that are doing this. But in terms of kind of starting at ground zero and moving to a program, I think the first step is really education and testing. So, building awareness and using demonstration projects to show people how this works. And then working towards the policy and planning frameworks. And those often require us to think at the global level, to the national level, to the subnational, to the local. And we're talking at the local level, right? So how are we actually implementing those visions of policy around greening strategies and bringing that to action? And that's really through the program development. So, thinking about both our policy and regulations at the local level, incentives, finding ways to build partnerships, not just across the city, but across private sector, community, and adjacent cities and communities. And then finally ensuring that we're making public investments so that there's kind of a network of both kind of the carrots, the sticks, and the opportunities to actually invest locally. So, building awareness, access to data, that helps us inform the policy and planning and leads us really to a strategic set of policies, programs, and projects. Hopefully for heat mitigation, but also climate resilience more generally. And I think we have the tools, and the examples for this localization, and the charge for us, as Karl noted, is ensuring that political and community will. So pushing that forward is really key. Thank you.
Thank you. I think I cannot add anything else to what Lisa just, how you concluded. Let's wrap up saying that extreme heat is a growing threat, especially in cities. We need to act, implement urban sustainable solutions, and work in collaboration. Thank you, everyone. Thank you, our panelists, for your insights, and everyone for joining us in this important conversation.
Thank you.